Hi, everybody. Karen Roby here for Tech Republic. IEEE is a really large worldwide technical professional organization that's dedicated to advancing technology for the benefit of humanity. And recently, IEEE unveiled findings from a study called Generation AI 2019. Dr. Karen Panetta is an IEEE Fellow and Dean of Graduate Education at Tufts University. Karen, thanks for being with us. This is a really interesting, really fascinating study, and there's so much to it, way more than we can cover in one video. But first, if you would just kind of give us a snapshot of what the study is and what it's looking at in general.
Sure. So every year, this is our third year that IEEE's been looking at artificial intelligence and really the public perception of it with all the advances that are coming out. So most people think artificial intelligence is this magic black box, but those of us in the field understand that it really is very robust, proven technology. So how do we look at how the public is going to accept it? So this study looks at millennial parents who have a child under the age of 9 and whether or not they would be willing to entertain the thought of using some of these different types of AI leading edge technologies in the future on their own children. So some examples include, 3D printed organs like such as a heart for a necessary heart transplant, artificial intelligence like a self-driving school bus. There's also things like whether or not when the millennial parents themselves are old, whether they'd rather have an artificial intelligence assistant versus their own children taking care of them. And then there's those in my own research area, such as looking at artificial intelligence to help to diagnose cancer in children, as well as looking at what I would call home health monitoring aids, such as a recliner that can actually tell you some of your own biometrics and monitor you without you even knowing it.
Yeah, really, it's so interesting the things that are already happening that some people don't even know about, and the things that are still to come, Karen. And one of the things that we talked about, I think, a really interesting part of this study, I looked at AI, how you mentioned how it's being used with a cancer diagnosis for children and how parents feel about that. What did you find on that one?
I'll say in different countries such as India, Brazil, and China, there's huge support for these types of things, and as well as in the UK and the US, but slightly lower in the US and the UK. And you have to ask the question. The question was not, would you allow artificial intelligence to make the diagnosis? The question was, would you seek out a doctor that actually utilized AI in their diagnosis? And the majority was very strong, saying, yes, we would. And that makes good sense because if you think about artificial intelligence, it's based on huge amounts of data collected from actual cases and actual diagnosis from hundreds of doctors around the world. So it's almost adding an additional level of confidence in that decision. And I think anybody going to a doctor would like to know that you've got all this extra data behind you to make a great diagnosis. Because think about it, if you make the wrong diagnosis, you could treat a child that really doesn't have cancer. That's horrible. And then to make the wrong diagnosis, if they do and not get treatment, they're both really detrimental to the children's health. So I think parents are really acceptable of this technology to do that.
And again, here, Dr. Panetta, as you mentioned it, you guys could see a change in terms of the way parents from in one area of the world accept this and are looking towards this versus others, right? We're a little bit less inclined here in the U.S. Is that right?
Well, in the US, it's about 59%, but it's like 94% in China. So, and I think part of that reason is countries that don't have universal healthcare accessibility, like India or Brazil, where the US, we have, very good health systems. They're looking at it as an alternative way to get fast, proper diagnosis early versus, having no information and not seeking treatment. So this type of opportunity allows people from developing regions to get access to technology information to help make those diagnoses when they might not have that expertise in-house locally.
Yeah, definitely. The access is certainly key. And also in this study, look at smart devices, that have health benefits, including, you mentioned it, I think earlier, a recliner chair that could have health smarts. Explain that for us.
So one of the biggest problems with all health monitoring systems is trying to get the patient on it. Now, I have a 90-year-old father, and all he has to do is get on that scale every morning, and I get a phone call every morning that he has not gotten on that scale from the remote monitoring. So, if they don't physically have to even know that they're being monitored, that's the benefit of this type of technology. So think about it. You know you're going to sit down in that recliner every day. You know you're going to lie in bed every day. And there's even some that use these types of technologies on the toilet. So, they're trying to find places where you're going to go and people are going to go and they can take these measurements without the patient actively saying, oh, I have to take my blood pressure, or I have to take my blood sugar, or things like that. So the recliner type of thing is a great example of that type of technology where somebody's going to sit in that every day. You don't have to really be conscious of it, and it'll automatically record it for you.
Yeah, we like things like that, that'll do it for us. We don't have to think about it or remember. And it's AI, of course, and sensor technology that's really making all this happen.
Yes, yes. I mean, there's some that can tell you, your blood sugar without pricking the needle, taking blood, so it's not invasive. There's some for even determining whether, you're at heart risk. There's also some, one of the things that I envision is in the future looking at kidney function and even testing what, I hate to say it, but what's in the toilet for different chemicals to make maybe colon screening cancer, things like that. So looking for those types of things, which we, right now have to proactively make an appointment, schedule that, and get some invasive type of uncomfortable tests. Nobody wants to do that.
No, absolutely. We do not want to. So this is a great thing to know that this is what, could possibly be here in our future. And I would imagine in your role and all of the knowledge you have, this is exciting to see all of this coming together and to see that people are starting to embrace the idea of this kind of technology.
It is, Karen, because a lot of the things that we see, especially in sensors, is the cost is coming down. And because the cost is becoming so effective, it means that we can get it to people that really need it, and we can get it to populations around the world rather than just the super wealthy or the more developed regions. And we can also use it as a tool even in schools. I think that's another big one. There are countries that actually use some sort of robots right now to monitor the health of children when they go into schools, which to make sure they don't have things like conjunctivitis or other contagious diseases that they're easy to detect that parents might miss. So, I mean, I would actually be happy if my school system had something like that.
Yeah, most definitely. Even a scanner they can walk through and can tell if they have a fever or not, because we certainly have a lot of that, especially this time of year. Dr. Pinner, we certainly appreciate you being with us here and sharing this information from this study. If you want to learn more about this study, make sure you check out our full article on Tech Republic. Thanks for watching.